Hi, this is Dr. L, and this is a lecture on the topic of tuberculosis and the pathogen that causes it, focusing mainly on Mycobacterium tuberculosis. And so I'm going to lead into this with this quote taken from the CDC site linked there, which says, on March 24th, 1882, Dr. Robert Koch, who is the person who came up with Koch's postulates, the first systematic way to link a pathogenic, typically bacterium, to a specific disease, thereby establishing the scientific foundation for what is called the germ theory of disease, which was quite revolutionary at the time, and still this Koch's postulates approach is still relied on today in various ways. So in the 1880s, when Koch was doing his work, he was highly motivated to help people, and TB was quite the scourge, as it still is today. So back in the 1880s, 1 out of every 7 people living in the United States and Europe died from tuberculosis. And while the death rate is lower today, it is still, as I'm going to show you, very significant disease globally. Okay. Oops. Here we go. So tuberculosis, or TB, is the disease. That's the name of the disease. This is a disease that primarily affects the respiratory system, although it can spread to other parts of the body. We are exposed to TB when we inhale the pathogen within droplets that are coming out of a neighboring infective person. So you'll have one person who's got active TB, and the bacterium is getting into their respiratory droplets, and they cough, sneeze, talk, sing, etc., and then those respiratory droplets are inhaled by a new person, and then that new person has been exposed to TB. Now, as I'm going to explain in a moment, not everyone who is infected with TB actually becomes sick and is contagious. So there's something called latent TB and also something called active TB. So this is primarily, though, a respiratory disease. So in terms of incidence, there's a lot of information about TB on the World Health Organization site, and you can get there also through the US CDC. So there are about 10 million people who get sick from tuberculosis or who are sick from tuberculosis in any given year. There are 1.5 million deaths per year on average, and tuberculosis is in fact the leading killer due to infectious disease today. This is today, okay, currently. 1/4 of the world's human population has latent TB. So 1/4 of the world's human population harbors the TB pathogen. And that's not trivial, okay? So half of all the people with TB can currently be found in the 8 countries listed there, Bangladesh, China, India, Indonesia, Nigeria, Pakistan, the Philippines, and South Africa. But we do have TB in the United States and other developed nations. I'm also going to point out that 1/3 of all deaths that are due to an antibiotic-resistant pathogen of any sort are TB deaths. So, to understand tuberculosis just for TB's sake is important, but it is also a really important infectious disease to understand if you want to grow your understanding of antibiotics, antibiotic therapy, and antibiotic resistance, which is very important in healthcare. And also if you want to understand how the immune system works, there's a lot to be learned from this pathogen. So here's a map from the World Health Organization site of global TB incident. I won't go into it in too much detail, but I'll just point out that the dark red are the TB hotspots, and the colors kind of go milder into the pale blue for where we have less TB. And so you can see that in the United States we do have a low TB incidence, but we do have tuberculosis. And nowhere on the planet are we free of tuberculosis. The situation, unfortunately, was somewhat improving as we headed towards 2020, in that we were making progress in reducing the number of TB infections globally. But since 2020, we have seen a resurgence in TB. So the green is showing all tuberculosis cases. The solid black line is new or increasing cases, and you'll note this tick up from 2020 on, and this is quite possibly due to the global COVID pandemic, worsening the overall healthcare situation for people. Also situations like war, migrant crises, and so on, where you have a lot of people living together in close conditions, not able to receive medical care, you'll see cases go up. We always track the occasions of co-infections with human immunodeficiency virus, the causative virus of AIDS disease, with tuberculosis, because people who have HIV are particularly susceptible to tuberculosis, and so those two diseases will often go hand in hand. So you can see, like, you know, these numbers going up, this is not good, right? This means more people are getting sick and more people are dying from TB globally. We have TB in the United States. This is not a disease of the past. Many people in the United States still suffer from TB. In 2019, there were 8,976 cases of TB disease in the U.S., which was the lowest number on record, but our numbers are going up again as well since 2020. So this is a serious disease that can cause you to become very sick if it is not treated and treated aggressively. There are treatments available to prevent and cure TB for the most part. However, there are extreme forms of tuberculosis that are so extreme drug resistant that they are not curable, and your patient would not be savable in that case, and that is a concern. So the main cause of human tuberculosis is the pathogen Mycobacterium tuberculosis, or M. tuberculosis. And that is what causes the vast majority of all human TB. But there are other mycobacterium that can cause tuberculosis disease, and all of these are clumped within a complex called the M. tuberculosis complex, MTBC. So there's a bacterium called Mycobacterium bovis that is associated with cows and may in fact have been the very first TB pathogen. Before we started pasteurizing milk, TB infections from Mycobacterium bovis were very common, and in fact this is still one of the main reasons to pasteurize milk, to keep us safe. The herds are checked for M. bovis within the United States, but an additional layer of protection is, of course, to pasteurize milk. And that will remove all pathogens, including Mycobacterium pathogens. These other Mycobacterium species, M. africanum, M. canneti, M. microti, M. capri, and M. pinnipedi, also cause TB. Mainly not in humans, though. So, for example, M. pinnipedi causes seal tuberculosis. So seals can get TB, and it's quite dangerous for them. The discovery of the pathogen that causes human TB, the discovery of Mycobacterium tuberculosis, was done in 1882 by Robert Koch. And he famously wrote then the statistic, 1/7 of all human beings die of tuberculosis. And he said some more things, and then if one considers only the productive middle age groups, he was considering only middle-aged people to be productive, so we've kind of moved on from that thinking, but in any case, then you could say that tuberculosis carries away 1/3 and often more of those middle-aged people. So it would harm all people, not just the elderly and not just infants. There's Koch working in his lab. I think this slide is going to be a little bit, just a little cut off. We'll see if we can adjust that. Okay, hopefully you can see that. So Mycobacterium tuberculosis has many virulence factors. It is a gram-positive organism, but it has an unusual cell wall in that its cell wall contains a very waxy chemical called mycolic acid, which is similar chemically to paraffin wax, the stuff that we could make candles out of or waterproof things with. And that mycolic acid, in combination with other lipids in the cell wall, allows this particular pathogen to be very resistant to chemical attack, both broadly in the environment as well as the chemicals secreted by the immune system, and many, many antibiotics. So the number of antibiotics that will work to treat this pathogen are limited. Other virulence factors that this pathogen has are that it grows very slowly, which may seem like an odd strategy because other pathogens will grow super rapidly and overwhelm the immune system, whereas M. tuberculosis grows slowly. And in this way, it is thought that it kind of like slows the immune system response somewhat. It's stealthy, and that actually is an advantage for the pathogen. Another virulence factor is that it can thrive inside macrophage, which are cells of the immune system, and it makes a toxin that is known as cord factor that damages lung tissue. Okay, I may have to move that up just a little before I can move that down. Okay, so just have to adjust my screen a little so you can see more things. Okay, so the basic etiology or progression of infection is that we inhale a respiratory droplet, and that droplet will contain the Mycobacterium tuberculosis, which in this slide, which is taken from your reading, it says tubercle bacilli, right? These are Mycobacterium tuberculosis. They're inhaled. They enter the lungs, and they travel through the upper respiratory tract into the deep respiratory system, the lower respiratory tract, and they make their way into the alveoli, which is the part of the lungs where we have these small grape-like sacs. They should be filled with gas. That is where gas exchange should happen. And inside the alveoli, there are numerous, there's the little gas pockets, and then there are numerous alveolar macrophage. Sometimes those are called dust macrophage. And once those the bacteria enter the alveoli, they will actually be phagocytosed by these macrophage. And from what happens there is sort of an it depends thing. And I'm going to talk more about that in a minute. But I want to point out that Mycobacterium tuberculosis has a very low infectious dose. In other words, it does not take a lot of these bacterial cells to infect you. So the infectious dose for 50% is estimated to be as low as 10 bacteria, which is quite low. So, this is, well, you have to inhale respiratory droplets and you have to be near somebody with active TB in order to get the disease. If you get, even 10 of those bacteria inhaled, you're quite likely to develop tuberculosis. Okay, I've got to move this back up before my slide will advance. Okay, so the signs and symptoms of active TB, and I'm going to be explaining active versus latent in a moment, are shown here. You will have a prolonged cough. You will have chest pain. You will cough up blood. You'll feel weakness and fatigue. There will be weight loss and a loss of appetite. So you're losing weight, but you don't really want to eat. Fever and chills and night sweats. These are all symptoms of active tuberculosis. So next I'm going to explain what latent TB versus active TB is, but I'm going to do that in the next video clip.